all the non-operative treatments initially, and she wasn't getting better. And so we did surgery on it. It was like 3 years ago, where I cleaned out her ankle, I stabilized her ankle, and repaired or fixed the tendons on the outside. Mm-hmm. She was doing good, and then started to have pain again, and most of the pain this time was along her tendons. And so at that point, we did physical therapy, we did bracing, we did a boot, and it just was not getting better. And so I talked to her about doing it in the office versus the operating room, and after some discussion, we decided to do it here in the office. I've been doing it for about 6 months in the office.
Okay. What has changed that allows you to do it in the office now?
Equipment's a lot smaller,
okay.
And even in the next year, it's going to get even smaller, where the camera itself is going to be the size of about a pen, and it just, insurance companies and patients in general, they do so much better when it's in the office. We're not having to undergo anesthesia. Sometimes we're able to drastically reduce costs by not even having to get an MRI. So we're able to visualize, with our own eyes as opposed to getting an MRI. And for Tanya, hers was a little bit different. I was actually able to, I stick the camera in right here, and I'm able to get in the tendons. So I was able to actually visualize the tendons and also clean out the tendons at that time. We schedule it a decent amount out, and we talk about everything that we're going to do before the surgery. Once the patient gets here, I actually give them a couple pills to kind of calm them down, and then I also give them a pain pill just to reduce some of the pain. I actually numb up their ankle, and I let them sit for a little bit so their ankle numbs up, and then I come back in and I numb it up once again so that we're fully numb. And what it is for Tanya, what I did is it's a little incision right here in the front of the ankle, okay, and then another incision on the other side in the front of the ankle, and I stick the camera in, I look at the ankle, and a lot of times we have, it's called synovitis, synovitis, within the ankle, and so I actually fully clean out the ankle, because anybody that has problems on the outside of their ankle, 92% of them, according to the literature, have problems within the ankle too. So I clean out the ankle.
When you say clean out, what do you mean by that?
So get rid of that synovitis, any swelling or anything that's within the ankle. It's a little instrument that it kind of just sucks everything out.
Okay.
And then for Tanya, what I did is it's a little incision right here and a little incision right here. I stick the camera in one side, and then it's called a shaver is what it is when you can clean out the synovitis that we're talking about. So I stick the camera in here, the shaver in there, and I start up here, and I just go down and clean out the tendons of any swelling or anything that's going on within the tendons.
Okay, you say office instead of the operating room, but I really didn't have anything to lose. He's a great doctor. I've had him for 3 years, so if he says he can do it, then let's give it a try. The first surgery was very rough. Very rough.
Yeah.
Recovery is terrible. Mm-hmm. I didn't walk for 51 days. It was rough.
Okay.
So, and this was a piece of cake.
Did that play into your decision to decide to have something in office rather than OR?
Ultimately, yes. Once I talked to my husband, and I work 70 hours a week, and we have kids, and I just didn't have that much time to put down again for operating room surgery.